let's start.
Okay, so Dr. Mishra, I know a little bit about you from your videos, but I don't know the whole story. I know that you moved to Germany about 10 years ago, 11 years ago. Is that right?
Correct. Yes. Correct. Yes.
And so
Yes.
you've been working in India before that, though.
Yes. For a couple of years, I worked over there. So I graduated from BJ Medical College in Pune in 2011. And then, as everyone does, spending some time for USMLE, then working here and there. So finding your way, basically. My path was not very clear right from the beginning. Like I was not sure which country and what am I going to do. I mean, during my studies, I wanted to go to the US. That was the plan. But being a surgeon in the US was like not my cup of a tea, basically. So that's why I had to change my plan. And then I went back to India from the US. There, I had to do my government bond thing because I was from the government medical college. So we have this 12 months working at the rural area. So that I did. And during that time, got to know about Germany. That time it was 2013. So in 2013, there was not much information. There were no Facebook groups like we have right now, or no YouTube channels like ours. So there was no much information. But somehow I got this hint little bit that okay, something like PG in Germany is there. Germany has opened its door for foreign doctors. Let me find about it, and then I researched and talked to people and everything. So then, yeah, I started learning the language in India and moved to Germany in 2014, by the end of 2014, for the further process and everything.
And did you do the whole process alone, or did you use an agency? Because at the
No,
time, I'm
no, no,
sure
not at all.
it wasn't that common at all that people from India coming to Germany
No,
as
there
doctors.
were, yes, that was not common, but there were still many agencies.
Okay.
There are still many agencies. I'm not sure if as many as now,
Hmm.
but that time also there were agencies. A few of my colleagues who were who have been approached by agencies, some also paid to the agencies. But what we ultimately realized is that what we could do, like what agencies were there, that they were also not very well versed with the situation. They were doing agency like they were sending engineering candidates, for example, to Germany or other countries. So they thought, okay, we are sending engineering for masters, so we'll send doctors also for the masters. Okay,
Hmm.
but then that was not the case. For doctors, it works totally different. It's not like getting admission to university like that is for engineering students. So the people who enrolled with agencies also repented that ultimately, that why did they do that? And information was not, that is correct. So, but we have to search it, and like it was hardship, like a hard job it was. But ultimately, it worked well. And another thing was that it was not people who wanted to be sure. Like now also people who go through consulting companies, they are people who want to be sure. Okay, they don't want to take any uncertainty in their hands. Like they don't want to take risk because things are doable at present. Also, everybody's like most of people are doing by themselves. Okay, I mean, not most, I don't know most, but I'm sure around 70-80% people are doing by themselves. It can
Hmm.
be done. When I did into 10,000, like 10 years back, when I did by myself, then why not at present, right? So, but that was the thing that I took the risk. So if things did not work well, then I could not be saying this today that, okay, look, I took risk and I was so research like oriented. I researched everything and did everything on my own. That time I would be, then if it did not work, then I would be sitting somewhere in the corner doing some emo ship or something.
Hmm.
Okay, so things worked well for me. That's why I can say that okay, I did everything myself without taking any consultancy.
And so two questions. One, why did you mean that the US wasn't for you for surgery? And secondly, why didn't you want to stay in India for the remaining of your specialization?
See, first of all, US was not for me because that is not my decision. That was decided from the side of the US because I
Oh,
did not
okay.
score very well. That did not I did not score very well on my USMLE step. Yeah. So
Okay.
once I did not score very well, then I realized that to become a surgeon over there, you need very high scores. You need lots of research work. You need contacts and a lot of and money is also a matter because if you don't get good course and you have to do some research assistantship and all those what you say experience things, US clinical experience things. So that requires money. That means living over there, doing those assistantships, and also 1 2 years time is required. So my friends who also did not get very good scores that time, they spent couple of years extra. They spent some money, and then ultimately they're working in the US at present.
Mm,
So that is also a factor, that the background that you come from plays a very significant role. What you can afford, what you cannot afford. And I'm not shy about it. Like, I mean, it's a fact. It was a fact of the matter. So, fine. I mean, I chose what was the best option for me that time. So that was thing about why US did not work out. If I wanted to go for internal medicine, pediatrics, maybe I could have gotten it, but I was like focused on surgery. So that's why I did not go for pediatrics or internal medicine. I moved back to India. And working in India, that never came to my mind actually, that I should do Indian PG or work in India. I never did that. That was never the plan, because I believe that people work very hard in India, and only top 1% are rewarded accordingly. I mean, people say that okay, in India you can have a huge like business as a doctor, you can be very rich, and you can like you cannot compare that to normal German doctor. Normal German doctor is not very rich, okay, but in India you can be that rich, but that is only the top 1% or maybe 2%. The remaining 98% people are like throughout in a struggling phase, in a job insecurity phase, that okay, every year young people are coming, seats are increased. So you for example, you are in a small town, or a maybe big town, the competition is as it is very high. In a small town, for example, so you are not set over there. You will be always be worried that in 5 years, even though at present your practice is very good, in 5 years there might be 10 other doctors in your specialty, and the patient population would be distributed, and your position as a top doctor over there is not secure for life. So that competition is always there, that insecurity is always there. That is in all fields, all walks of life, that is true. But in developed countries, I don't want to generalize it to developed countries. I can say about Germany. Here, since the demographics are not that vibrant as in India, like there are not young doctors coming every year out of medical colleges. I mean, there are coming, but the proportion is not as much as in India. That's why here you are like little bit stable. That okay, instead of 5 years, you can worry about in 10 years maybe. Okay, so that was my thing, that okay, the hard work that it requires to work as a doctor in India, in most of the cases, the rewards are not as great
hmm.
as I
Yeah.
would like them to be.
It's actually incredible how when you hear stories about doctors working in other countries, maybe even within Europe in some other countries, but especially outside of Europe, how much different their experience is during the specialization phase or the PG phase. It's so difficult, and they treat it not with the respect that they need to be treated as a doctor. But in Germany, it's completely different. So when it gets difficult in Germany, I almost feel bad complaining, because I feel like the experience of a doctor working in India right after graduating is way more taxing and difficult for much less compensation than it would be in Germany
Yes,
or a developed country.
yes,
Um,
yes.
but why did you choose medicine in the first place? Was it like a family decision, or was it a passion of yours from the beginning?
No, nothing like that, nothing like that. So it was, see, in India, I mean, you also come from India, you
Yeah.
know how it is. If when you are good in school, you get good grades. 20 years back, it used to be like, I don't know if it is now also, it used to be that either you become doctor or engineer, or maybe CA. Some people become CA as well. So that was 20 years back. So I was one of the examples of that, that I used to get good grades. So I wanted to go to IIT, but then when I got in 11th class, then I realized that, okay, calculus that is expected, that is a little bit above my level. So then what has been good is that there's an interesting story about how I actually got into medicine, but let me share that. I've never shared that online. Okay. So I realized that I don't want to like I should what you diversify my eggs and not put all my eggs in the IIT basket, because that's going to burst. Okay, so then I diversified, and I thought about medicine also. That okay, let's do something with biology. Now that time when I was in 12th class, I was not very sure. My aim was that okay, we'll do 12th, we'll see, do BSc, MSc, something like everybody. I was not very, what you say, uh, guided. I did not have much of the influences where you have some examples. Okay, somebody has done this or this family member. So I did not have any of those things. I used to hear from my friends and colleagues. That was my source of information. So when I thought of biology, then that time I did not know that okay, like how difficult it is to become doctor, or what can you even become a doctor. That was, so I just said okay, let everybody, my two of my friends are doing biology, let me do that. That was my starting point over there. Okay, I went to my family, they said okay, this is a coaching class, we have to pay this, I think that time 18,000 rupees or something it was there. They did not know with this exam you become doctor or what happens, no idea. They just gave me the money. I went, I took admission to coaching class because my friends were taking in that classes. Okay, so I took the state exam, like this entrance exam, without much preparation, like because everybody is doing it. That's why I was doing it. So then in 2 months preparation, whatever preparation I did in 2 months, I got a rank which was actually good for the preparation that I had done. Because my rank was 1300 in like all Maharashtra.
Mhm.
Okay. So then I thought that okay, with this and with 1300 initially, I thought, or I was told that since there were that time 2000 seats in Maharashtra in government medical colleges, so I would get one of the seats in government medical college because my rank is 1300. There are 2000 seats, simple calculation. What I did not know that time, the concept of reservation.
Mm.
Okay. So then slowly when this like counselings happened and everything, then I did not get the seat. Okay, because the seat got cut off at 1120 or something. Rank it got cut off, and mine 1300. So very close, 100 ranks difference was there. So I had not, by this time, as you must be knowing in India, there are a couple of months delay. There is a lag between your exam and the counseling. So other people have taken admission into BSc and everything. I did not want to go to BSc because I was very sure that okay, I'm going to get a medical seat because I'm so cool that in my first attempt, without much preparation, I got 1300 rank. Why would I not go to medical college? So I was very like chilled that I will not take any admission. But fortunately or unfortunately, one of my friends, they had gotten the form of our own college. I was in Bhavan's College in Mumbai, so that okay, at least fill the form. I have signed that form. They've submitted it. So basically, I had a admission. So after 2 months of waiting for that counseling, when I got to know that no, there is a like 100 rank gap and you are not going to get into medical college. So it was a shock for me basically. Like since 2, 3 months, I was in that mindset that okay, I was going to become a doctor, and ultimately it bursts and it like you are again going to be a nobody. Like because doctor was somebody and I was nobody, and I knew also all nobodies only. So I did not know any somebody. So so I was like, okay, now it's all shattered because I'm going to again be in that rut where I was in my life and in my circle. And then I went to the medical that BSc course where I had the admission. I went first lecture over there, and after that lecture, there was a microbiology lecture. And I went to the staff room with that teacher to tell her that I'm new and I would like to know how can I cover up the syllabus that has been done in 1 month time. So she asked me, where were you? Why? So I told her I was waiting for this, was my rank, and I was waiting for this. So she started scolding me, okay, in the staff room, that what do you think? Does everybody becomes a doctor? Like, why were you, why do you think BSc is a joke? You are waiting 1 month for your medical seat. And so she was started scolding me in front of the entire staff over there. So I told to that, and I mean, that time you are young and arrogant, and you think too high of yourselves. So I was at least. So I told her in front of the staff that, okay, look, it's enough. I'm not going to set foot in this class anytime, like anytime in the future. And I went that did that. After that, I went to the admissions department. I told the clerk that okay, I want to cancel my admission. It's the first day I want to cancel it, and he started counseling me that look, this time you're an in-house student, like you studied from this college. That's why you're getting admission. You are getting in this. Next time, if you appear after like taking the exam for second time, it will not work out. Then you will come back. Maybe you'll not get admission here also. Then what will you do? I was like, okay, you are a clerk, right? I told him that what is your job? Like, you're a clerk, okay? Do your job. Don't give me gyan. Okay. So I told him on his face that you are a clerk, you do your job, don't tell me what to do. I will do what I want, I think is right. So then he was like, yeah, he cancelled it. And then I called my father that, okay, I have cancelled my admission. So he was surprised that, okay, you it was the first day, and how did you, what happened? Like, so then he told me that, okay, keep your cool, like don't make decisions in like hurry. But if you feel that that's the right thing to do, then fine, that's okay. So then I was like, fine. From there, I went to, I've searched the people who I knew in the college, the campus. I met some of them, asked them, okay, which is the good classes? Because last time was a fluke. I just took the nearby coaching class where I was going, which is the good one and everything. I researched a little bit in that campus itself on the same day. And then from the same day from that college, I went to that classes. I took admission in that classes over there. So that was my, and then that was the beginning. First day, I realized that I wanted to be a doctor.
Mm.
After everything that happened before that was just game. Like I was just playing with everyone. So that was the time. And that, then 1 year I sat at home, studied for the exams. And the next year, fortunately, it worked well and I got good rank. So I could go to one of the good colleges in India. So
Very interesting.
this was a journey. It's very interesting. I have like my family and all. I mean, they know this, but online this is the first time. That's why I got a little carried away while explaining it. Also, because it comes, those 20 years old memories come to life when you explain it. Like,
Do you
yeah,
still remember the faces of the teacher, the clerk, or is it
I don't
blurry
remember
now?
the, I don't remember the faces. I mean, blurred. I don't remember the faces because remember the emotion that I have that time. So not the faces. Yeah.
Okay. But I found it interesting that you mentioned that being a doctor, that you attributed that to being somebody at the time.
Yes. Yes.
But is that the reason that you chose medicine? Because it was a status thing, or was it like you've in the family or just culturally being a doctor? It means
Yes.
that my
Yes.
identity is now sure. I don't have to question
Exactly.
myself
Exactly.
anymore.
Exactly, exactly. That is exactly, you put it in a very right way, because for me, that was the most important thing, that the status. And if you have good status, then financially you will be okay. Like, doctors are never poor. I mean, usually they're not poor. So uh, yeah, so you'll not be poor, you will be doing well for yourself, and you will have good status and respect in society. That was the motivating factor. And I come from Bihar. So in Bihar, in North India, uh, status and these things are very highly regarded. I mean, everywhere in the world, but there people live for that. Okay, so that's why you will see people for UPSC and like IAS, IPS, and most other, the people sit there for years and years together to take those exams, so that at the end they could justify their being, like they could be self. What do you say that? Um, validation of self-worth, basically. So from psychological terms, it's a very bad thing that you need external validation for your self-worth, but that is how it is in the embedded in the society over there.
Do you still feel the same way, or has your approach towards medicine, being a doctor, changed once you've
No,
become
that has changed. In fact, that changed after medical college itself.
okay?
So that 5 6 years in medical college, that, I mean, it's fine. I now approach it as a profession.
Hmm.
That, okay, that is my job, that is my identity, I have to do right by it. And yeah, so I do the job, like, so that, see, that is thing, that you aspire for something that you don't have.
Hmm.
Once you have it, that becomes, you become used to it, then that is like normal to you. Okay, I'm sure, like a few days back, one of my residents, he was cribbing about the work life, this thing and that thing. So I told him, see, life that you're living is a dream for millions. Okay. So don't crib about that, because you feel that your life is so bad because you have to stay half an hour late, or maybe you are, instead of 12 patients, you have 17 patients today. But that is a dream of millions of people in across the world.
And a few
So
years ago,
don't,
you signed up for this. You wanted this so bad, and
yes,
then when you
yes,
get it,
yes.
you always find something to not
Yeah,
like about it or be
exactly.
unsatisfied, I guess. That's
But
true.
that is a human nature. That is a
Of
human
course.
nature, I would say.
Yeah. Yeah, definitely. What would you say? You have experience with doctors in India, you have experience with doctors in Germany. What
Hmm.
have you noticed any differences from the mentality of doctors in India versus doctors in Germany? I'd like to divide it into obviously the specialists. Once you're done with your Weiterbildung and you're a specialist,
Hmm.
it's something else. But also the junior doctors coming to Germany. Do you see a difference between the Indian junior doctors and the foreign junior doctors?
Um, See, there are different types of people everywhere. So you cannot generalize it as such because there are people. Can you hear me?
Yeah, sorry,
Yeah. Yeah. Okay.
my nose was running, so
Okay.
I muted.
Oh, no, it's okay. It's okay. So there are different types of people in Germany and in India. So we cannot generalize it. But what I would say is that, and it also depends upon the training that we have received in India. Okay, so in most of the cases we have this chalta hai attitude that okay, it's okay. It, what is the big deal? So, but here it's not like that. Here it's like they are very specific and certain, like about certain things. Like they
Yeah,
have to be. It has to be like that. For us, it is like, yeah, a little bit 19, 19, 20 chalta hai, like 19, 20, 21, it's all the same. Here, it's not like that. If it's 19, it has to be 19.
that's so
So
true.
it
That's
cannot
very
be
true.
20. So that is one mindset difference is there. And Indian doctors, obviously, when they're new, they will work very hard. When I was new here, I used to work very hard because it's also important. It's not like just because you have to show that you're working hard. It is important because you have to stay in the system. Because otherwise, you have lots of other drawbacks. Firstly, because of the language. That if you say that, okay, I will work same as the native people here, and so you cannot do that work that you have done is same,
Mhm.
but the quality of work, at least in the beginning years, is very different. Even a POT, what you say, intern
Mhm.
here can communicate. That is the most important. I'm not saying that somebody's like doctor is less trained or less knowledgeable. I'm saying that because you cannot communicate and you cannot understand the system, you will have to put extra effort
Yeah.
when you are a foreigner in Germany. So intern can normally talk to the patient, can normally talk to the consultants. He can communicate better. So people, if a first year resident foreigner and a intern or maybe second year resident foreign resident and a intern are together in one case, the consultant will listen more to the intern, or maybe intern will be able to express better and express more than the foreign trained doctor. So that is, it's all about the language and communication. Later on, once you have mastered that, then there is no difference.
And also just understanding how the system works, the Pflegeheim,
Exactly.
Pflegegrad. For me, it was all so confusing. I had no idea that you can
Yeah.
distinguish between a nurse and a Pflege, or like there's any. I didn't
Yeah.
understand
Yeah.
this because in India we don't have that.
Exactly. The social system here is so like systematic. I mean, in one way, it's a good thing that it
Yeah.
is there, that people are taken care of and they're not left to rot. Another way, it makes it all very complicated for workers, like for people like us. I mean, I learned now I again forgot everything because now I don't need to do the residents. Like now I'm a little like after my specialization and all, so I don't have to do that myself. I tell people, like, I delegate those things. So I even if I forget, it's okay.
Mhm.
But yeah, it says but when I came here, it was difficult because there's Kurzzeitpflege and Langzeitpflege, hospice. There are many concepts that one has to learn.
I'm just going to start a recording on the laptop so we don't have to pause the call. Maybe for the other
The,
part, we
the
can send
call is
another link.
the call is going to end in 10 minutes as it is.
Yeah. Oh, the call itself.
So the call is going to end in 10 minutes. So there's no
Oh.
problem that we can just click the link again, which I sent you, and we'll be back.
Okay, okay. Let's do that. Um, right. So, and why did you choose orthopedics? Did you
Yeah,
always know, or did you decide that after coming to Germany?
No, I came to Germany with the plan of working in orthopedics
Okay.
because I initially, as I said, that was my plan altogether after medical college because I had interest in orthopedics. And second thing is that we have to study less in orthopedics. That was told like that time. So in internal branches, you have to study a lot and everything. So I was like, okay, fine. And orthopedics earn pretty well as well. That was also the case in India at least. So these factors were said, okay, fine. Uh, you have to study less, more earning potential. What is better than that? Like, let's do orthopedics. Like that, it was like that. So that was the thing that that's why I planned to for the US, and that did not work out. Then I moved to Germany. So
Mhm.
orthopedics remained constant throughout.
What would you have done if it wasn't for orthopedics? Did you have an interest towards anything, the medical part of it, or
Yes, see, all medical parts all are the same. Like all have their pros and cons, and
yeah?
all have their uh, what you say interesting. When you go deep into anything, you find it interesting. Okay, so if or not orthopedics, then maybe I don't know, general surgery
So it would have been
or something like
surgical,
that.
definitely.
Yes, yeah, surgical, yes,
Mhm.
yes.
Do you,
So
because it's very commonly said that the specialization in Germany for surgical fields, it's a really good option, but maybe even for medical clinical fields, it might not be, or I mean, not necessarily might not be, but surgical fields are, it's more of a benefit coming to Germany. I guess it has to do with the fact that there are smaller hospitals where you get more time to operate as
no,
opposed to,
no, no, that's not the case. The thing is that why I also say this many times in my videos. Thing is that in internal branches or in psychiatry, for example, pediatrics, you have options in another countries as well.
okay.
Okay, you can go to the US and you can become internist over there because the scoring because they need internists, and you can go to the UK and you can become an internist over there. But to become a surgeon, these countries, other countries, they won't allow you. They won't take you. That is the thing. That if you want to become a surgeon in a developed country, Germany is, I think, like I mean, I'm not say only country. There might be some other countries, but one of the leading countries. Because as I said, in US, very the chances of success is very low for surgical residency. Same is in the UK, that you go there, you work for years together, ultimately with MRCS and all those things, and like 10 years, 12 years, 14 years, then you can become a consultant a surgeon over there. So, so in Germany, you do here 6 years of residency here. After that, maybe one, two fellowships, and then you become a consultant surgeon over
Hmm.
here.
Hmm.
So about the training that you mentioned, actually, it's not like that. In surgical training in the UK and in the US is definitely better than that what we have in Germany.
Hmm.
Okay, it is because of the structure. Like they have more structured training in the UK or in the US. They have more structured training. They have like rotation systems. So if you go 6 months in one rotation, you're doing that thing for 6 months. Okay. So in Germany, you can do like 2 years, 3 years in the same department, same thing. You're doing same work again and again, and not operating or doing same like basic operative things. And just stuck over there.
Hmm.
So then might be you'll have to change hospital in Germany. That is a benefit here in Germany. You can change hospitals once you feel that okay, I'm stuck over here, you can change the hospital. So yeah, so the training is not that great when I compare that to US and UK, but this is during residency period. Later on, like once you become FACAs, then you are allowed to, or you're expected to operate, in fact. So
Hmm.
that was the thing in my case also, that before FACAs, operation is like, fine, you are doing some things, but not very sure, not very confident like that. And after FACAs, they leave you in the OPs alone with assistant, like resident. Okay. Now you have to, after 2 months, you will be good. So because you are alone, you have to do it now. So, so after residency completion, that difference that I said, that is there between US, UK, and Germany. But maybe say 5 years after residency, if there is still that difference, that I don't think so. Because in 5 years after residency, here also surgeons have operated so much that and alone that the difference is like gap is fulfilled.
Hmm.
Yes.
Okay.
Yeah.
So Um, the next topic I wanted to ask you about is the agency, the consulting firm.
Yeah.
DMiNetz, I assume the the expansion of that would be Deepak Mishra International Nets. What is the story behind the
DMiNetz is
name?
a yeah that is similar. Like almost you're almost right. DMiNetz is Deepak Mishra Nets, so
Okay.
network
Ah,
like
okay.
nets. DMiNetz, and since the name was little short and what you say difficult to understand, I put the international after that. That
Ah,
okay,
okay.
it becomes something like something international. Like people will remember. Otherwise, if you have such a odd name, then nobody will remember. Um, yeah, so that name I just I was sitting one evening. It was 2017, so I was sitting one evening trying to find a name, and all the common names that medical PG and career in Germany, all the things were like it was not very appealing. So I said, and that time when I started this thing, there were bigger plans to include things in DMiNetz. But then, being full-time doctor, you cannot have lots of things that I realized over the period of time that okay, you have to have like small dreams. You cannot have bigger dreams because you don't have time. If
Hmm.
you want to do that, then you have to give up your medical career. So that
Hmm.
was not the plan for me. So it remained as a like basic consulting company, but we had bigger plans at the beginning.
And but you said 2017, so that's actually quite sooner than I thought that you started because obviously I was exposed to the videos towards the end of my medical school when I was looking into these things. But 2017 would mean that maybe 2, 3 years after you started working in Germany, you had
Yes,
already
yes,
had the idea
two
of,
years after approbation. I passed my approbation exam in 2016.
okay,
So, and then I started making YouTube videos. And the YouTube videos, the purpose of YouTube videos was basically information sharing,
okay,
because I was getting lots of like every doctor gets like lots of emails and posts on Facebook and Instagram. Instagram, I was not on Instagram, but Facebook about how the pathways and everything. So you have to say same things again and again. And when there are friends and friends of friends, you cannot just ignore that. Like you have to answer that. So to for such people, I have created the initial videos that okay, instead of explaining everything again, I'll give you a link, watch it for half an hour, and you know everything. So like that, I created initial like few videos, 10, 15 videos. And what happened is that instead of questions getting lesser, questions became more. And from more people. From now, it was from unknown people, like who I did not know. They were not even acquaintances. They're just random people from internet, random doctors and medical students. So that's how. And then what happened is that the consulting companies in India, which 3 years back my friends have paid money to, uh, they started contacting me and they wanted to work with me because they had very huge problem of unsatisfied customers,
mm,
because they were in India. They did not much process, like they were taking the money with the promise that we will help you, and later on they were like it was not happening because there was a shortage of information. So they started approaching me that okay, you work with us, let's do this together, like that, to collaboration basis. And I was like fine, let's see what they do. And then I got to know their systems, how do they do, and I was like no, this is what they are doing. It's totally like that I cannot do. I cannot put my name to it because that is on the what you say on the verge of fraud, basically. That yeah, so you're taking money, lots of money, and you are taking money for something that you cannot promise. You're promising something that you cannot promise. You're offering something that you cannot offer. You don't know. You don't have it yourself. So then I parted ways with those companies, and they had null idea, they had zero idea, basically. So then I said that, and then since the YouTube channel started growing, more and more people were going to the consulting companies, taking their quotations and sending me the screenshots
mm,
of that okay, this is a quotation. They have went to three companies and they are asking me this, which one do you think is correct, which one should I go forward with? So when it all happened, then I realized that okay, I mean, if there is so much trust in the market that okay, they will go to three companies and they will ask for my advice that which one I think is the better, then why don't I start a company myself? Yeah. So the credibility was established in 1 year or so from making YouTube videos.
right.
Okay, so then I said, okay, fine, let me do it, and I was very hesitant doing it because consultants we always had very bad image
Yeah.
in my eyes also, that okay, consultancy. So I was like, maybe my family won't approve of this, or my wife won't approve of this. So I was like, should I do it, should not do? So after lots of what you say thinking, I said, okay, let me try. If it doesn't work, then I'll give it up. Like it was tried. So, and somebody, other people are doing it. Like other people are doing it. I am in the position to do it better because I actually am a doctor. I have done this process myself. I'm here. So I can, I to what you say, to have a positive feeling about it, I said that, okay, I'm saving those people who are going to get defrauded by other companies.
Hmm.
So that was my thinking that, okay, let me do it this way. Yeah. So fortunately, it worked. Yeah.
And first of all, thank goodness that it worked because you've definitely informed and helped a lot of young doctors that wanted to come to Germany with the information that you've provided, including myself. So thank you for that, first of all. And but did you, as you, because it sounds like it was a very organic process. You, okay, it just made sense. I'll
Yes.
post the videos, and then people contacted you, and you thought, okay, I'm spending my time doing this. Might as well make it an official thing. But then
True.
at this time, you were a practicing doctor. You were doing your residency in Germany. You were preparing for. This was after the approbation, so you were
Yeah.
just starting the specialization and everything. So, did you have in the back of your mind or on the side the idea that I could maybe have a side career in this? This could be something for me long term, or was it not even a factor at that point?
No, no, it was not. See, a side career is something that is long term, which I could see that, okay, I could do this for 20 years.
Yeah.
Okay. Now, this is not something that I don't think at this, like, I have been doing it for 7, 8 years. My YouTube channel has become 8 years old. I got recently got notification.
And
So, and
congratulations
this,
for almost 20,000 subscribers now.
yes, yes, almost 20,000. Yes, thank you. So, yeah, having 20,000 subscribers in this particular niche,
Hmm.
where there are only doctors who want to go to Germany with the video quality that I produce, that is really good. Like, I'm thankful to the subscribers because many of my videos, which I watch, like, or my wife watches, she's like, yeah, why do you even make these videos? Like, they're so, uh, those so disheveled appearance, so bad sound quality, so bad camera quality. So these in these the day and time that people are making such nice videos, why don't you? I'm like, I create low effort thing. My purpose is to share information and not to look good on camera and have like very good what you said editing. I try my best. I'm not saying that I'm ignoring it, but some skills I don't have, and I don't go searching for best people in editing and best people. I'm like, fine, so far it's working. It's working. So I'm thankful for subscribers that they have like they have accumulated 20,000 people have come behind this channel. Okay, this was about, and then you asked me about if it was a side career, a planned side career for me. No, it is still not. Okay, it is still not. This I would say now. See, if you see in terms of revenue, one would say that okay, how not, like sometimes it can, some years it is also more than your main career, like main job. Okay, so but do I treat it like my main jobs? No, I don't treat it like my main job. I do one video per month, maybe not. That is not also not sure. Like you will see how inconsistent it is because I don't see that I will be doing it for 20 years, 30 years. Okay. So I will be doing it till the time demand is there. People are watching it. People are writing to me, appreciating it. I will do till it makes like it is fun. I will do it. And then when I feel that, okay, there are more capable people, more younger people who want to do this and to do it better, bigger, then fine. I mean, let them do it because to become an education consultant was never my, like, never in my profile, never in my thoughts.
Hmm.
So
Hmm.
it became by chance it happened. And certainly when people, like for example, when you say that okay, you have benefited from the content, then certainly I feel good about the work, that I feel that the work that I did, that the time that I spent was for a good cause, like a good use, that you benefited from that. So that those things keep me motivated. Like few days back, I was in my hospital, and one guy he came. He was a like I was working as an BG. So BG is a Berufsgenossenschaft. So all the Arbeitsunfälle and all they would come. So he had some needle prick, so needle stick injection injury. So he came and he recognized me. I said, I know you. I'm like, how do you know me? He said, I seen you on YouTube. Yeah, okay. So he was one guy, one doctor working in one of the hospitals here, and he knew me. So, and this happens every couple of months. Okay, the somebody will on the train station, the airport, maybe like there you feel like a celebrity that somebody recognizes you. So, so yeah, it happens. I mean, it has happened. So those things motivate you. That okay, fine. And people when they come, they are like they talk nice to you. They say that okay, that has helped them, and they're thankful to you. So you feel good that your work that you're doing was not just waste, and then you continue that. So that is how it. So by the time till it's going, it's fine. But that is not my like say full-fledged education consultancy. That was not the. That
So
was
do you
not the.
have
Yeah.
plans for the company in the future, or are you just playing it by ear? When the demand comes, you'll keep doing it. Where if it weans off, then you will stop.
The yeah, actually like that.
Hmm.
Yeah, because my plans are in the health sector,
Okay.
like towards health improvement. I also created some channel. There's not much traction on that as of yet because I'm not putting more. That this cycle that has started on this channel, for example, on that I get comments, people ask for more questions, then I create more content. So that traction has not yet there on that channel. That's why. But I'm more inclined towards creating something in health niche, maybe towards healthy living, towards wellness or longevity and those things. So maybe in bone department, like in orthopedics, osteoporosis is there. There is arthritis. Many people because those things. There are people who are really in pain, who are suffering from that. Okay, and then that is also my expertise. Like I have
Hmm.
studied so long for that, so there I can be more credible and more like helpful to people. Now, why I say this in this consulting also, I help people. But here, when you see, like purely from a businessman perspective, uh, these things, what has happening in Germany, or the influx of doctors and everything, nothing is in your control. Okay.
Hmm.
So maybe 5 years down the line, they might say that, okay, we have enough doctors now, we will close everything down. Okay, we don't want foreign doctors.
Hmm.
Maybe
Yeah.
they'll put one more exam. Maybe India will have like more opportunity. People will start going to some other country. So maybe the right-wing party might come and they will say that, okay, we don't want foreigners. So that is about the demand. Other thing is that the process it is as it is 1.5 years, 2 years long. Now if people who are in my consulting company like the mentorship programs, for them I'm involved till 1.5 years, 2 years. I'm talking to them every 2 weeks, every 4 weeks. So the pricing, if you see it looks up expensive, but the time that it takes, the effort that I have to give for guiding those candidates and everything, that is also not less. So that's why like when it comes to personal consulting, the individual consulting, so it takes a lot of time and effort, and then that makes it less scalable.
Yeah.
So you cannot have 100 candidates. Okay. So who would be, you can have like 100 people in your group maybe, or say like or maybe 1,000 people in your group. But with that is there's some limitation. This business has limitations.
Not
Okay.
scalable without stretching your neck out and putting more revenue and effort into it, maybe hiring someone or making someone dependent on you, then you would be stretching yourself out to more
Yeah.
danger as well.
Exactly,
Yeah.
exactly. You would be, you can do that. I mean, you can scale it, but then uh, you need to have how, for example, talk little business here. If I today want that, okay, instead of I personally, because I guide my candidates myself, I take yearly 12 candidates. Okay, I don't take
Mhm.
more than that,
Mhm.
maximum 12. So I don't take more than that. So if I say that, okay, from tomorrow I will take 20 candidates, I have one more guy who will mentor these candidates. Now, this guy has to have that experience that I have had.
Yeah.
Okay. So that means he has to be somebody who has been here for so many years and have so much experience. Now, most people who are in this stage are not interested. They are interested in their own things. They are like Oberarts earning good salary. They're not interested in this. And here, if you're not interested, then if I teach you everything, okay, then tomorrow you will go away definitely because this is knowledge business.
Yeah.
And knowledge, once you have my knowledge, you will have your own shop.
Yeah.
Why will you work with me or for me? Right.
For sure.
So here is a knowledge business. You're not creating a product. It's not a product business. It's a services and knowledge business. So here you can have say lesser like non-doctors who don't know this process in and out, and whom you teach, and they can guide them. Like for example, you can have BSc graduates or MSc graduates in India, for example, who can be guides and mentors. So they will stay in your team for long duration. But then to train them with the system which is ever changing, every 2 months things are changing here, every like application is different. So every time you get different reply from the instagrammer, like, or the for the
And they need to
licensing
speak
authorities.
German as well, otherwise they'll be
They
lost.
need to speak. Yeah, no, they don't need, when they are customer facing, for example, if they
Yeah.
are facing the client in India, for example, they don't have to be German speaking, they
Hmm.
can communicate with them. But then there is no reliability, like the
Yeah.
client will not trust them,
Hmm.
that what they're talking about. I mean, at present we have a team. It's not like that we don't have a team.
Hmm.
We have a team, but ultimately I have to like reconfirm things again, because what the candidates like believe what I say, and what everybody else in my team says. They are like, okay, this information is fine, we have taken it, but we don't. They don't rely on that information.
Okay.
So this is the level of credibility or trust that our candidates have. So in that situation, uh, building a team becomes difficult.
Okay, so
So
now that we've sort of opened that door into the business conversation, when did you start thinking about the financial part of things? When did you start getting involved into, okay, what do I do with my money? What do I just put it in a
very
bank
late,
or
very late.
yeah.
Very late. I wish I would have learned about these things like 10 years back.
Hmm.
I started it like maybe 3, 4, 5 years back. When
Okay.
my once my daughter was born, she's about to be 5 years old. So she was born. Then I started. I got a little more serious. Like,
Yeah.
okay, career, business, money, thinking about future, thinking about your legacy. Then you start thinking about what would you leave, right? Till that time, you're thinking about yourself. What would you do in your life?
Hmm.
And after that, you start thinking about what would happen after life. Like, what if something happens to you, or when you like retire and become old, what would you leave? How would your children, apart from a loving parent, apart from that, what else would they remember you
Yeah.
for, right? So that time I started like got more interested towards personal finance and all those things. So yeah, so not very long, like for 5 years, I would say.
Hmm. And so
Yeah.
what would
And
you
also thing
say?
is that for
Hmm.
doctors, till that time, you also don't have lots of savings. That is the thing that you earn because you're earning late as doctors. So we have less like less knowledge, first of all, and also less money to like do something with that money.
Hmm. Hmm. And
Yeah.
what would you say is your current, what are you playing with in your mind about those financial things? Where did you land so far after the 5 years of looking into
Uh,
personal finance?
Yeah, yeah. I see. As you know that like anybody who has a little bit idea about personal finance knows about the basic things, like the real estate is one of them.
Hmm.
Stocks, mutual funds, they are one of them. Since we have the privilege of being in India, like Indian, like what is it, OCI and German citizen, you can be in both markets. Like you can do things with US markets. So I have kept things diversified. Like I have no one favorite. Okay, so I do some real estate in India. I do some in Germany. I have some things in like in stocks, mutual funds in India, some in Germany. So like that, I have kept it because uh, how the way things are working in Germany, I'm not sure how the future will be.
Mm.
So that's why I'm not saying that, okay, I'll have nothing to do with India and I'll keep everything in Germany because it's uh, a safe place financially. I mean, safer market financially. But I'm not doing like that. I'm keeping my these things like eggs in different baskets. Obviously, like in India, you have a, a better like growth, a
Hmm.
faster growth. Yeah, in Germany, the growth is slower. Yeah, but that's okay. Like 50% grows faster, 50% goes slower. That's okay.
Hmm.
The real estate that I do in Germany, I do with the government loan, like not the government loan, the bank loan.
Yeah.
Yeah. So obviously everybody does like that only. So because the interests are comparatively lower, interest rates. In India, what I do it like I pay upfront
Okay.
and don't go on loans. So because then when you get rental income from India, then it's your income, like basically because there's no loan involved.
Yeah.
And here, when the rental income comes, that goes to the bank.
Hmm.
So you don't have to pay anything from the pocket.
Yeah.
So yeah, so this is how, I mean, I'm not a financial like expert or anything. This is how I do my small like personal things.
And
So
speaking of which, what do you think? Where do you see Germany going in the next 10 in our profession, but also generally
see,
in the
in our
next
profession, I'm
15 years?
not much worried. Like
Hmm.
I'm our profession, it's okay. Now things which have like last couple of years since the war broke out, or even before that also, what people say this every day in the news. Like it's not something like new that I'm saying. That they have not invested much in innovation. They have not invested much in infrastructure. So what they have enjoyed for last like post World War II, they have enjoyed. They have built up things and they've enjoyed for few years, and now there's a time to like pump more money in to build up more infrastructure, to build up more networks and invest in technology. And now they don't have money for that, like have less money for that. That is the thing. So and also these things influence the politics. Like if people are what you say very unsatisfied with the state of the affairs, then they would be more populist, like more right wing. Okay, then they will feel, because the right wing propaganda, they say that okay, we will make everything great again.
Yeah.
So then and that is happening in all of the world, in US we have seen, in Europe also, most of the countries, like not most but many of the countries, the major countries are turning right wing government, having right wing governments. So that might happen here also. So, professionally, I don't have much worries because the population, what you say, demographic changes are going to happen further. So, doctors will be required. That is fine. But in general, the thing that we have, like shortage of people, one point you are happy about it because then you are required, like you are not surplus, you will not be sacked someday, because that's happened to a lot of engineers. And because the companies go down and the engineers are fired. So but with doctors that will not happen. But other side, because there's shortage of people, there is shortage of people for everything. Like you want kindergarten for your children, there is no person over there. You
Mhm.
want something, there's no person, there's no people over there, there is no nursing staff over there. So overall, that luxury of service that we have in India, because there are people, there
Yeah.
are many things people can do for you. You pay money and there are people, they can do things for you. You just
Yeah.
need to have enough money to pay them. Here it's not like that. Here you need to be super rich to afford those kind of services. So yeah. So that's why I said that, okay, I mean, it does not look very rosy. And these opinions, in my case, like also are influenced from your daily life, basically. Now I have two children, two small children, okay, and my wife is doctor. So obviously my life will be chaotic. Okay, obviously I'll have to arrange that today kindergarten is closed, tomorrow this is there, today I have deans, tomorrow she has deans. So, so my worldview is not the what you say the most rational worldview. Okay, so somebody should not watch this and say that okay, Germany is doomed and it's going all down. It's not like that. It's my things that like live daily that influences my outlook towards the place where I live.
Right. Yeah, perspective is everything, and also the life that you live feeds what you
Hmm.
see. So you have to
Exactly,
individually manage your risk of
exactly.
but we do have that privilege of having one foot in both sides of the world. So that's
Yes.
very fortunate, I think.
Yeah.
Yeah, so I would want to conclude the question part of this with just to ask you, where do you see yourself, your career, your family, just in general in the next, I'd say 10 years, 15 years? Do you have any plans, or are you more of the let's see where it goes type of person?
I have always been that kind of person. Let's
Okay,
see where it goes. Like, because I don't want to, uh, what you say, shrink my imagination by having a fixed plan.
interesting.
So, yeah. So that is, I mean, there is a different way to look about it.
Yeah,
Somebody would say that this is a rudderless ship which does not know which way it is going, and somebody would say that okay, ocean is big. Let's see what we can find and what we can discover. I mean, but I don't have any fixed plan. The normal career trajectory that is going on, that we all know, like it goes on slowly. It's a lifelong journey of learning things in medicine. About the business thing, I'm very interested in. like value creation and value addition. So that I will keep doing this consulting thing or the PG, medical PG in Germany that I'm doing, that will continue. But I'm more interested towards the health niche also, and there I think I can do better and help more people instead of like just operating on, say, when I operate like three people in a day. Okay, I'm helping three people in a one day. There are ways where you can like help 300 people in a day, right? So let's see, but I don't have any like fixed limitations for me. That only
That's an
this I will
interesting way
do.
to say. That's an interesting way to phrase it because someone would say, "I don't have any fixed goals or plans," but then if you can also frame it in saying, "I don't have any fixed limitations," because if you name it, then that's where you stop.
Yeah,
That's also
exactly.
interesting. Yeah. So yeah, thank you. I was just wanted to dig your brain a little bit. So the even if the ship is rudderless, it's been going well so far. So I think you're on the right track.
Yeah, see, that is the thing that if you what drives me or what is my thing is that we have to keep doing, like keep doing things. Okay, everything does not have to work out. Like
Yeah.
as I said, in my journey, I came to Germany. In If you asked me like say 25 years back, when I'm now like 37, so when I was like 12, 13 years old, I would have not known that I would actually become a doctor. And even my 12th class, I did not know. So it was like I was doing what let's see, that has always been my approach. Now important thing is that keep doing. That is my this thing, that okay, keep trying, and things work out, and at the end don't take things very seriously, because at the end nobody survives life, you know, so everybody is going to
That's
die.
true. It has a
So
100% fatality rate
nobody,
every time.
yeah, yeah, there's a 100% fatality rate. So I mean, if you have like at the end say 5 crores in your bank account, or you have 3 crores in your bank account, it's not going to matter. Like it's going to matter if you have like Ambani rich or something, then it's going to matter. But so we don't have to bother about like small things, like it's okay, chill, like let's go. And that keeps your mental health very clear, like very good. Okay, and that I find is very important, that because if you have to like live for a longer, if you plan to at least wish to live for a longer life, and not only longer life but a longer healthier life,
Mhm.
then this mental health comes to is a very significant thing. So that this thing, that not having that stress and not having that fix, this thing that I have to do this, that keeps me like little relaxed. So yeah,
Interesting.
wonderful.